Okay, welcome back to part 2 of exam 2 for the EMT class. So when would an IM injection not work? An intramuscular injection would not work if the heart is not able to pump. Remember, we've got to have vascular networks being pushed with the blood flow going out and coming back. But if the heart's failing, it's going to keep that blood near the core. And so putting an intramuscular injection in someone who's got a blood pressure that's super hypotensive, we're talking like 70/40, and they're having anaphylaxis, intramuscular injection is probably not going to work. It's worth a shot, but it's not going to work. And in this situation with the exam, we're not going to be doing an intramuscular injection. It's all based on what your protocol is at the station that you're working. And what class does anaphylaxis fall into? You know, when we talk obstructive, we talk hypovolemic, we talk about cardiogenic. What class does anaphylaxis fall into? It falls into distributive. So anaphylaxis is a point of distributive shock. It can't distribute the blood and everything throughout the system, the nutrients, the oxygen, the carbon dioxide. And if someone's hypotensive in shock, what position do we want to place them? We don't do Trendelenburg, where we had the legs were elevated at about a 20 to 45 degree angle. We don't want to do that anymore. It's completely supine. All right, methods of examination. You have auscultation, palpation, manipulation, and we want to make sure that when we're assessing the abdomen, palpation works great, inspection works really good, looking at it, palpating, but auscultating the abdomen is very hard to do and takes a lot of practice. And if we even went to the point of percussion, percussion is even worse than auscultation, because percussion takes a lot of practice. So you see those doctors where they're tapping on their fingers on the chest and they're trying to listen. That's percussion. But we're talking auscultation, listening for bowel sounds. It's very difficult to do. And when do we look for MedicAlert tags? We look at MedicAlert tags for around the neck, around the wrists, around the ankles, tattoos, wristbands. We look for those MedicAlert tags in the very beginning, because those could be high indicators for what's going on with the airway, breathing, circulation. So that's a good indicator for what's going on. Hemodialysis, that is talking about dialysis when they take the blood out of the body, they filter it through a machine, and they kick it back into the body. The problem with that is, if we pull the blood out of the body, do we still have the same amount of stuff in there to keep the blood pressure up? No. So they're going to need fluid replacement if they start having a problem, and they're going to have decreased blood pressure. So we've got to watch that. They're basically in an induced shock at that point, a hypovolemic shock, because they're pulling that blood out to filter it. UTI is a urinary tract infection. 3 key things that you're looking for in a UTI is they have a fever, painful urination, and possibly an altered mental status. Those are 3 big key indicators, and it happens primarily in females and when they're elderly. Polyuria, polydipsia, and polyphagia. Polyuria is excessive urination, polydipsia is excessive thirst, and polyphagia, phagocytes. They're eating the cells. Phagocytes eat the dead cells and destroy them. So excessive eating, excessive hunger. So those 3 things happen when somebody has hyperglycemia, the super high blood sugars. And they also come with a fruity acetone breath. So if you've ever smelled nail polish remover, that's what it smells like. And finally, the last thing I want to touch on for this exam is a radial pulse. If you feel a radial pulse on someone and you think that they might be having some type of shock, a radial pulse can only be felt when they have a systolic greater than 80. If the systolic blood pressure has dropped below 80, it's going to become weak, it's going to become thready, and you may not even feel that radial pulse, and you're going to have to move to a carotid. And remember where we feel for pulses, brachial on the infants, radial down here, if we're checking for CPR, we're checking up here. Think about the AEDs. Think about medical terminology for this exam. But this is going to be primarily on drugs. We're going to be talking about airway, your medical emergencies we've covered up to this point. But big things on airway, big things on drugs, and stuff on abdominal emergencies and stuff endocrine emergencies and respiratory emergencies. Those are some of the 3 big chapters. So good luck on this exam. You guys will do well. I have good faith in you, and we'll talk to you later. Have a safe week.